fired her. I don't know. She was not working there like 6 to 9 months after this happened, which thank God she was doing like occupational health surveys. And in that case, that's fine. If you're trained enough to do just like occupational health, physical exams, fine. But to take a job and willingly put someone's family, patients in danger, absolutely not. I will never support that. That is never okay. And no one else should either. So yes, I disagree with this comment. And no, I will not have mutual respect for someone else just because they
want to address is nurse practitioner clinical hours. This creator goes on and talks about how nurse practitioners only do 500 hours and that's not enough. Nurse practitioners are focused in a specialty. So they do between 500 and 800 hours in a very specific type of medicine. So for example, family nurse practitioners focus on primary care through the ages from birth to death. Acute care nurse practitioners, which is what my certification is, really focus on inpatient medicine and acute problems. So we work in roles such as hospitalist or ICU. I personally spent almost all my clinical time in an ICU, whereas physician assistants, they get about between 2,000 and 2,500 clinical hours, but that's throughout all their rotations. No physician assistant gets 800 hours of ICU time or 800 hours in family medicine or even 500 hours in family medicine. That 2,000 hours is spread out among all different types. So we're really getting a specialized focus education in the area where our certification is, which makes us very different. That is why we have a scope of practice, and physician assistants can really work in any setting because they're trained a little bit in all those settings, where nurse practitioners are specifically trained, highly trained in the area of their specialty.